Captain, it's great to chat to you again. You wrote a very lovely Facebook post about what you're doing at this time. You say, doctors save lives, physiotherapists make it worth living. Just very briefly, talk to us about how you help a COVID-19 patient who is going to be weaned off a ventilator.
Okay, thank you very much, Sally. So it's important to start off by saying physios are part of the multidisciplinary team alongside the doctors and the nurses. And basically, we're trying to ease the burden of COVID-19 by hopefully decreasing the length of hospital stay of the patient, to improve the patient's prognosis, and then also to prevent and reduce complications. Now, these might be short-term or long-term complications after the patient has left the hospital. These might be respiratory or musculoskeletal. So what we do as physios, we can boil down to what is called cardiorespiratory rehabilitation. So basically chest physio. So what we do for mechanically ventilated patients to ultimately wean them off the ventilator, we can divide into three things. Now the first one, we help to protect and to keep the airways clear. Now that is to try and reduce or prevent respiratory secretions buildup in the chest. So we ultimately to help wean the patient off the ventilator. So we use a variety set of skills for that, like airway clearance techniques, your percussions, your vibrations, even suctioning, where we put a tube down the throat to suction the secretions out the lung. Now, the second one is where we assist the multidisciplinary team to prone the patients, to put them on their stomachs, and that helps with oxygenation. Then lastly, we maintain the integrity of your musculoskeletal system, your joints and your muscles. So basically, I can say that we keep you moving or mobile when you can't do it for yourself. And that just reduces the severity of ICU-acquired weakness from the prolonged stay, and then also to promote functional recovery, so that when you move from the ICU ward to high care, there's not so much of a complication from the ICU stay.
I'm just wondering what it's been like. You work at one military hospital, which is a fantastic military hospital, and that you treat members of the Defence Force and their families. It's really got an excellent reputation. Have you been busier than you have ever been? I mean, what is it like working in that hospital at this moment?
Well, Sally, I can describe that as physios in general. I mean, it's a very interesting time to be a physio as well. It's been very stressful, and the workload has increased by a lot. But I guess, you know, we stick to our principles. We know what we're working towards, and I guess it's up to the public and up to us to educate the public on what we do. And not only that, we help them in the hospital, but we can also help them once they leave the hospital or move out of ICU.
I mean, that's a really interesting point that you make, is also a lot of people are being told that they shouldn't be admitted to hospital when they might normally, in a quieter time, be sent straight into hospital, because the hospitals across the country, private and government, are filled to capacity in some areas. So a lot of people are having to stay at home, and I know that you were saying to me before we went on air that there's quite a few things you can do, because of course the chest complication is the big worry. There's a lot of things that you can do at home for yourself in terms of physio techniques to keep your airways open, to look after your health. Could you please just talk us through, maybe even give us a little demonstration, because I think this is the sort of thing that's going to be extraordinarily useful for people who are sick, suffering at home with COVID-19.
Okay, now thank you very much, Sally. So it's important to address this, because there's been a lot of videos circulating on social media that are trying to give patients advice on how to do your own chest physio at home. And I have to caution patients on those videos, because normally the intentions are good of the videos, but it kind of gives the impression that there's a one-size-fits-all in terms of exercises for COVID patients. So let me just explain what we do for you when you're not in ICU, when you're in high care or isolation wards, or even when you're isolating at home. So the first objective is to protect your airways again, to keep them clear of secretions. Now, although a productive cough, a wet cough, is a less common symptom than a non-productive cough, a dry cough, you do get patients that have respiratory secretion build up in the chest. And that could be due to many things. That could be due to an underlying chronic illness like chronic obstructive pulmonary disease, or just a weak, ineffective cough, and even be due to altered breathing patterns. So what we do, we not only use those airway clearing techniques, but one big tip is prone lying. That's been said quite a bit. Lying on your stomach for those times when you really feel short of breath. One of the things we also do we use instruments. Now, these are instruments like incentive spirometers that help with inhalation. We use positive expiratory pressure blow bottles. You'll see a lot of times we have a blow bottle where patients blow into with a little bit of water in the bottle. And then obviously the important thing are the exercises, the deep breathing exercises. Now, the deep breathing exercises, we do them with emphasis on thoracic expansion, and that will increase air entry into the lungs and just promote inhalation. There are exercises we call active cycle of breathing, where we can teach you also those exercises, and then mobilization. That includes retraining of your muscles and just to increase your endurance. That could be things like walking, stair climbing. So, Sally, it's very important for me to say this, that not all COVID positive patients need physio. And those patients are your asymptomatic, no symptoms, no comorbidities. They will stay with the quarantine guidelines that have been provided. Now, for those that quarantine at home, that are COVID positive, that might have these symptoms, I have to say it's very important to get a hold of your physio, because the exercises have to be modified for what you need.
Sure.
You need to be evaluated and given the exercises according to what you need. We have to caution on the side of one size fits all.
It's a good point you make. But so in other words, you can speak to a physiotherapist, perhaps over the telephone, and they can give you some ideas. I mean, it's interesting that you're saying is if you do feel short of breath, lying on your stomach can assist you a little. And just general deep breathing and staying mobile are all good things to try and stay as active as possible, even if you are sick, without, of course, over-exerting yourself. Thank you so much for chatting to us today. Some really interesting insights. And just a reminder, of course, from Captain Fanazwana. He works at one military hospital in Pretoria. He's a physiotherapist, but he's reminding us that getting better from COVID-19 takes a lot of work and a lot of dedication. And keeping yourself healthy is absolutely crucial.